National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at Nationalnutrition.ca. Today, I want to speak about a topic that's very close to my heart, memory. In my practice, I do a lot of work in neurology, and one of the things I often encounter in my patients is impairments in the normal function of their memory. Memory is really important for how we get through life. We use our short-term memory all the time. Did I take my pills today? Didn't I take my pills today? Did I remember to have breakfast? Didn't I remember to have breakfast? All these little things are really important for how we function in our day. If you don't remember to have breakfast, you're not going to understand why mid-morning all of a sudden you're feeling really hungry, you're feeling very tired. It's because your body doesn't have the nutrients it needs. And again, all triggered by a lack of memory. On a grander scale, it's that lack of long-term memory. When you start to lack long-term memory, you might forget skills you once knew, you forget facts you once knew. You'll have that tip of the tongue syndrome where you forget the word you're searching for, or you may forget people's names and faces, and that can be a big problem both from a professional standpoint, but also socially. If you run into people who you see all the time, you're supposed to know their name and you don't, it leads to a lot of socially awkward situations where you're searching for their name, especially if you have to introduce them to somebody new. So these are all signs that you're starting to lose your memory. And the interesting thing about humans is because our brains are so good at filling in gaps, often we come up with a lot of strategies early on when we start to have memory loss to compensate. And so because of all these extra strategies we often don't see the early signs of memory loss. So if you do see these, I do recommend getting assessed early and make sure that there's no major disease process leading to your impaired memory. But what does lead to impaired memory? Well, impaired memory comes from a variety of different reasons. Basically, anything that damages a neuron. Neuronal damage can happen due to intoxication, it can happen due to oxidative damage, and it can happen because of a lack of nutrients. Basically, your neurons are starving, and the neuron that holds that piece of information, that memory, it doesn't function properly, and it can actually die off, and that information or that memory can be lost, and that's how we run into chronic memory loss and memory issues. So if you start to see these symptoms, start to assess yourself. How am I eating? Am I taking in enough fruits and vegetables? Do I have nutritional adequacy? And of that, what are the most important nutrients that I should look at for my memory? Well, one of the biggest one is fats. Your brain is essentially a big blob of fat, and primarily a fat called DHA. DHA, or docosahexaenoic acid, it's one of your omega-3 fatty acids. It actually makes up 22% of your brain. If you have inadequate DHA, you cannot insulate the neurons don't function appropriately, and you end up seeing memory loss and other brain and neuronal impairments. Additional to the omega-3s, you'll also want to look at cholesterol. I know, I said the big C word. Everybody hates the word cholesterol. Well, your brain is actually 25% cholesterol. It's one of the most important nutrients in the brain. Your brain needs cholesterol for normal, healthy function. And if you have impairments in your cholesterol, that can actually lead to loss of memory. In fact, there's a lot of new studies showing that cholesterol-lowering medications may actually lead to cognitive and memory decline. And so, always check those side effects with your doctor. If you started a new medication and you start to see symptoms of memory loss or cognitive decline, check with the doctor and make sure it's not just the medication causing it. Because, sometimes medications can actually be the cause of memory loss. And you want to make sure, because if that is the case, speak to your physician about possibly changing prescriptions. It doesn't mean you can never take a drug. All it means is you should have an informed discussion to minimize the side effects of the medications you're on, because those are causing harm. So if you do have memory loss, there are a few other things you can do to help manage it. I know I mentioned your omega-3s, very, very important. I'm also a big fan of something called ginkgo biloba. Ginkgo biloba is a herb that actually increases cerebral blood flow. So it's been shown in many studies to help improve the memory. I also like something called vinpocetine. Vinpocetine is an extract of periwinkle or vinca minor, and it's a very effective herb for lowering inflammation that often then leads to memory loss. And it's actually used to help treat stroke and a lot of the symptoms that come with somebody having a stroke, one of those being memory loss. Now, for people who are younger and they're trying to optimize, looking for what we call a nootropic, one of my favorite herbs for memory is Bacopa monnieri. It's known in Ayurvedic medicine as Brahmi, and it's also known as water hyssop commonly. So Bacopa monnieri, it's a herb, and the reason I like this one is it helps to manage our responses to stress, but most importantly, and this is a neat one, it's been shown to improve memory and cognitive function in healthy people. So it actually improves memory in people that don't have any type of decline. So to me, that's one of those things that you can use to really help optimize your function, optimize your health, and it's one of that class of supplements and drugs that we call nootropics, or things that basically improve the function of our brain. So if you do have memory loss, watch this video again, write down everything I said. That way you'll always remember it so that you don't make any mistakes when you go to your health food store. Check out some of these supplements and see if they help you. And again, talk to your doctor if you start to see the early signs of memory loss, just to make sure that it's not a more severe condition. So if you enjoyed this video, please share it with people you know would enjoy it too. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.